Now. This meeting of the Dundee Township Mental Health Board is called to order on Thursday, May the 8th, 2025, time being 7:01 p.m. Please call the roll.
Adame. Auger.
Present.
Connell. Here. Corrins.
Present.
Kempf.
Here.
Avila.
Present. We're good. Mr. Sanchez, would you please lead us in the Pledge of Allegiance? All rise.
I'm just waiting for everybody to stand up. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen. Chair will entertain a motion to approve the agenda.
I'll move.
Moved by Member Corrins, second by Connell. Discussion?
Yes.
Yes.
I had submitted some comments to Coordinator Sanchez that did not make it onto the agenda. Specifically, last month we spoke about having a survey done. That was supposed to have been added to the agenda for vote. I'm being told that we probably cannot do that tonight, but I want to make sure that the board members receive the material and find out if they have any questions on the survey so that we can have it on the agenda at the next meeting.
Okay, and the next meeting being June the 12th.
Yes, well, the next meeting, if there's one earlier, even better.
Fair enough. Okay. Well, it is members' prerogative to call a special meeting if they want.
So I would like to amend the agenda to add discussion about the survey under old business.
Okay, so we're going to do item C, discussion of survey. All right. Member Corrins, you made the motion. Do you accept the amendment?
I do, and I'm wondering if we should also add an additional amendment about the discussion of the policies that
Yeah.
because I saw the email as well.
For the and you want?
Reviewing the McHenry board policies and coming up with a few that we wanted to.
Okay, so want that under old business or is that under new business?
I would say, well, it's kind of continuing from old business.
So it's old business.
So, yeah, or it could even be board discussion.
Yeah.
All right, I'll put it under old business. All right, so with the two amendments, do you amend your motion?
I do.
Mr. Connell, do you do the same?
Yes.
All right. If there's no other questions or comments, the amendments are adopted to include old business item C, discussion of survey, and item D, policies. All those in favor, please signify by saying aye.
Aye.
All opposed, same sign. The agenda is adopted. Chair will entertain a motion to approve the meeting minutes of the April 10th, 2025 regular meeting.
I'll move.
Moved by Auger. Second by Connell. Discussion. Hearing none, all those in favor, please signify by saying aye. Aye. All opposed, same sign. Minutes are approved. Chair will open up the meeting for public comment. Does anybody wish to address the Mental Health Board this evening?
Point of order,
Yes?
isn't the minutes a roll call? Or am I forgetting something?
The minutes do not require roll call. No.
Okay.
I think I've watched too much county board video to keep that there. All right, since there's no public comment to be made, we are going to move to the coordinator's report. Mr. Sanchez.
Apologies. This mouse isn't working for me. There we go. Okay, had some events recently. The roundtable on the 23rd, there were about 18 attendees present. Some good discussion, focused mostly on teen mental health. And I'll get the minutes, the notes sent out to you tomorrow, actually. I think, as we continue to do these, what we're seeing is it's sort of just starting to build a network where you have, up in McHenry County, they have a very robust network. And I think what our Kane County Public Health Department does is a lot of facilitating the people that are out there and trying to connect them to residents. So I think that's what's happening as we continue these conversations and people can talk across the gulfs that they normally experience. They, like school districts and service providers, for instance, don't often talk. That's been something that's come up. So That was a good meeting. The pancake breakfast, I know President Avalar and Member Corrins were there for the first responder mental health fundraiser. And I forgot what the total was. Mark, do you remember? Did you see what the total was? They raised a decent amount of money. It was a nice, well-attended event there. And some upcoming events, we have the Multi-School Resource Fair Thursday, May 15th from 5:30 to 7 at Lakewood Elementary. This is what was previously at Meadowdale Elementary last year. And I think it became too popular maybe for that school. Other schools wanted to have their own, so they decided to combine multiple schools into one night. So that will be happening then, and the Carpentersville Fire Department let us know that they will be having an open house October 4th. It's a little ahead, but it's a good thing to be aware of. I want to create an events page on our website so we can start having like a regular calendar that everyone can see, some of the things that are coming up. Our current version of the Revise is the company that we use. The module, I guess, is not activated, so I have to put in a work ticket to get the calendar module activated, and then we can create the events page. So should have that up soon.
Okay, before we move on, I think Member Auger has a question.
Well, I just want to confirm, we're going to have Revise do the work, correct? In terms of setting up a calendar page?
Well, I think all they have to activate the module so that
Okay.
it's an option for page creation, because it's currently not there, and it should be from everything I'm reading from, the information that I have. So I just have to put in a ticket and have them activate the module, I guess, is what will need to be done. And then it's just as simple as like create a new page, select the calendar option, and then we just populate it as we go along with the events that we find out about.
Okay.
I'll add that to the task list
Yeah.
for next week. Do you anticipate the ticket will be filled by early next week, or is this take 2 weeks with
Yeah,
these guys?
it shouldn't take long. Once they get to it, I imagine it won't take, it'll be pretty easy for them to do.
I just don't know the service level agreement for tickets like this, if it has to be done within 24 or 48
Oh, yeah, I
hours,
don't
or
know.
if it's, okay.
I
I just
don't
don't want any surprises. All right. Any other questions? Let's
Nope,
continue.
that will work.
Let's
Okay.
continue.
At some meetings recently, the St. Charles 708 Board became aware that, they were working on their grant selection process at their most recent meeting, so I attended that. They are a little bit of a different board. They've been around for quite some time, since about 1986. They don't have regular meetings. They don't focus on, they don't do like roundtable discussions or anything like that. All they do is just run a grant program, and that's it. So they meet just a few times a year as the grant program is released. They review applications. They have multiple sessions of providers coming in, and I think it was about $680,000 that they had to parse out amongst, I think it was 28 or 29 different service providers. No, it's just for St. Charles, the city, the village. It's not township or anything like that.
Okay. If I may intervene, and especially as we have incoming board members here, St. Charles, as Mr. Sanchez pointed out, is a 708 mental health board. It is a municipal level board, City of St. Charles. It is not township, it's definitely not county, but they do abide and apply the Community Mental Health Act just as we do, except their territory is the City of St. Charles, and of course, the city does cross into DuPage County, so it's a small part of DuPage, but they cross county lines. So just want to clarify that. Oh, question, Mr. Auger?
Yeah, so was this request to attend the board initiated by you, Mr. President?
It was not, but I do like the initiative that let's go ahead and observe a mature board and one that we've not had interactions with. But definitely, though, we'll keep an eye on that as far as if we don't want inundated to have to attend all these other board meetings, but
Yeah,
I approve it.
so I would like your approval going forward, because we clearly have things that we expect Coordinator Sanchez to work on that I think would have taken higher priority than this.
I suppose I just saw it as an opportunity to again, review a more mature board, and I got some good information from it. But yeah, going forward.
Oh, going forward will be fine, but the initiative, I definitely support the initiative that you took. But going forward, we'll definitely put it on the task list if we know something. If something big is brewing, definitely we'll prioritize accordingly.
Thank you.
Okay.
And then Ecker Center, Member Auger, Adame, and myself met with the staff, discussed some of the current opportunities and ideas that they had for programming, and got a good tour of the facility. it's a nice big place, and there's a lot going on there, as Ray and Belinda got to see. They're pretty full with everything that they're doing there. I don't think there's a square foot unused in that building. So yeah, it's just, again, good to see the day-to-day from one of our providers, one of our larger providers. And then District 300, I met with them as part of the conversations we've had with the roundtables of service providers seeking to gain more access to school districts to try and meet some of these teens essentially where they are during the day if possible, or what opportunities are available there. So I was able to have a good conversation with some of the administrative staff, programming staff for District 300, and we'll be following up to just help facilitate a meeting between them and service providers, just so that they can start talking amongst themselves and find out what kind of opportunities may be available for them.
Okay, I have a couple of questions on D300. Obviously, the focus here is probably on the students. Is there anything that's done for faculty members that have challenges like mental health?
That did not come up, no.
Okay.
That could be included in the conversation, certainly.
I definitely want that included, only because I have heard from a couple of residents about D300, and should we, because obviously it's not just the students, it's the teachers have their own, and administrators have their own mental health challenges as well. Also, are you planning something similar in the near future for D220?
I have not. They do have a section of Carpentersville that falls within Dundee Township. Our primary school district here is 300, so I haven't approached 220 at this time.
Okay, at some point, please do. I mean, we can determine the timing later, but certainly from the last census, at least 3,500 residents of the township, and I know it's a small sliver of Barrington Hills, but we have a small sliver within D220 that I always want them covered consistently, so we cover all residents consistently, even if it's different school districts. So
yeah, I mean, I'd be curious to see what they're already doing. I'm not familiar with anything that D220 has going on, so yeah, we can definitely reach out and make a connection there.
Okay, good. Go ahead.
Let's see, and then, officer elections. So according to the statute, you have to hold a meeting prior to July 1st of each year, with the year beginning July 1st. So the year being July 1st to June 30th. So our last meeting for officer elections was held on June 17th. So you will need to have next month an officer election for the next year. But you don't need to do it when new board members come on after that. So in December, if there are new board members appointed, then we won't have a need for an officer election.
And just for board members and the public, the reason we were having them is because last year, the General Assembly amended this law to not have to have, because we were having officer elections 6 months apart. Now we just basically keep it to a year, and certainly the June 12th meeting will be the one we'll have our new board member on the board at that time, and then we'll have our officer election for effective date July 1st. So I just want to clarify, the reason we were doing 6 months apart is because this section of the statute had not been changed until last year.
Okay, and then you had asked me to look into converting the admin coordinator position into a W-2. Legal said there wasn't really anything from the legal side to consider, and it really just comes down to a matter of preference for the board. If things are better for the board to continue with independent contractor format, that's fine. If you want to go to a W-2, that is also fine. So it really is what works better for the board and its purpose. Having an independent contractor, it's never been the intent of the board to skirt, having to provide benefits or anything like that. That's not even an issue for this board. So it really just comes down to what it is that you need from the position. Factors to consider are just the cost, because there are benefits, FICA, IMRF, things like that you'll have to be budgeting for, and then just deciding, if you go in that direction, do you want set office hours, things like that, and what kind of relationship do you want with the administrative coordinator position? Do you want it to be, managing all the day-to-day stuff, or, just what needs to be done and when? So it's something, whenever you would like to discuss it, if you want to put it on the agenda, let me know. And
Okay, what will be, and this was something that I know the board members had asked about as far as to have this discussion with our council. This board set out back in 2023 to become a mature board based on metrics. And when we have that discussion about metrics later in this fiscal year, that's what we'll introduce. Well, are we ready to start looking at that, or do we still have some ways to go before we reach, as we said, the level 3? And we're using the metrics based on the capability maturity model for integration. That's what we discussed here. That's what we've gone over several times here. I think, remember, Ms. Trustee Harney, you were on the board at the time when we did that, so that was back in 23. Anything to do with anything that this board does, I always emphasize we go by metrics and we go by standards, not by anecdote, or I want data to support what we do for making our decisions. And we are getting to that point of maturity. We're not completely there yet, but we are getting there, and definitely our one-year plan has that as a goal to get done, because we are close. Okay? Good.
And then, so I started to populate some of these, like timeline sections. So this is something that I think, maybe sitting.
Before we go on,
Yeah.
this kind of falls under the events section, but last month we had received some information about when Pivotal was going to be having classes. One of those classes was supposed to have taken place on 4/15. Any feedback? Did it happen?
I haven't heard from them on that yet, so I would have to follow up and ask.
Okay.
Let me ask a question. Did they invoice us? They haven't
No.
invoiced us yet either, so.
Okay, so I'm gonna just emphasize, we've got to get that calendar up online, because there is an event coming up in June, and we want to make sure that our residents know about these things. We cannot solely rely upon Pivotal and their advertising channels to get the word out. So, something that might go into a June newsletter for, following months, but I would very much like to hear how that went at the next meeting, and make sure that we've got the calendar up and running.
Okay.
Okay.
All right. Yeah, so these timelines, we need to, I think perhaps Mr. President Avalar and myself, should start sitting down to just get into a little more detail, and then start bringing back to these meetings, what it is exactly that you want underneath these goals as far as when you want things done, and start to define some of the objectives. Because obviously, you have your one-year plan, that's where this is all originated from, but some of that, it needs a little more specificity, so that we can actually create timeline actions, rather than just, here's what our goal is, our overarching goal is,
Okay. We will definitely have those discussions between now and June 12th. And certainly with the one-year plan we put in place, and also many components, we're going to talk about the survey tonight, the timing of that. We have the 3-year plan update. All that's going to be in here, and we will get that done.
Okay.
Mr. Auger.
So, Mr. President, can we, I guess, assume at this point that we will have a fleshed out goal plan?
We will have a fleshed out goal plan for June 12th.
Okay.
The percentage of fleshing out, I want obviously the sooner time period first, whether we get to all the way to February 28th, fiscal year plan. I can't commit to that, but at least we will definitely get the immediate months fleshed out completely.
Okay, so what does immediate months mean? Through September, through October?
At least through mid-year, if not to the early fall, mid-year of the fiscal year,
Mid-year of the fiscal year, then
which
that
would be
would put us
August,
out to
September.
August.
Right,
All right, so we'll have a fleshed out plan for everything up through August.
yes,
All right,
we'll make that happen. And if we get more than that, then we'll get more than that.
all right, thank you.
Then just a couple late additions. The SharePoint site, I was hoping to have it completed shortly after our last meeting, but getting in there and starting to just actually play with some of the different site options that they have. There are 2 different versions. One that is really more for kind of a back end, a team working on things. It's more folder driven. There's another version, the communication site, that still utilizes folder systems, but is a little more, I think, amenable for the purposes of this board and the members' access to information. So I'm hoping, probably not going to be able to do it tomorrow, but early next week, I wanted to demo it with President Avalar, have him be the kind of guinea pig to get him onboarded into the system, see if there's any bugs that occur along the way, get that smooth, and then send that out to everybody else. Our tech people have to do that. They'll have to create the like login profiles and everything and send that to your email for the board.
Is the tech people, is that a separate engagement, or is that under the current service level agreement with the township?
As far as I know, that's current. That's within what we're normally doing, so,
Okay, so we should not see any additional costs.
no.
All right. Mr. Auger?
Okay, to date, Coordinator Sanchez has spent approximately 20 hours working on SharePoint to set it up. Can we delegate this to the IT company to take care of it? This is 20 hours that we could have had Coordinator Sanchez working on other tasks for the,
Are we at that
For
point
the
where we need
board.
to?
Well,
outsource this?
so essentially, the IT company, they just have a general knowledge of SharePoint. So even when I was speaking with the tech person and just kind of wanting to explore the communication site a little bit more, their knowledge base is more on the team site. So I think, part of those hours is just kind of learning, and
Okay, but I
And
hear,
so-
I remember August going, it's
trying
being,
to-
it's being a self-learning where do we need to
Yes.
bring an expert in to help you,
Yes.
so get over that learning
Well,
curve?
yeah, so the idea was essentially, I did a walkthrough with them and got kind of lay of the land, but anything beyond that, we would need to hire a consultant because it's beyond their expertise. They're not,
Okay, based on the hours, it already sounds like it's beyond what, this should have probably been farmed out to help minimize the amount of time you're spending on this, because as you said, 20 hours is a lot of hours. And whereas we might be past that point where we need to look at that outside help.
yeah, I didn't know it would, become that, but again,
Okay, we have an early
hiring a
indication that it
consultant
has.
seemed a bit like of a heavier measure.
Well, it might be, but then again, I'm seeing had we found this out maybe 15 hours ago, if you're going beyond a reasonable amount of time, we could have acted then. This is a learning, this is how we're getting mature. So we see this early on, we need to get some additional help for you and not have you do, you're not in this alone. And obviously, we have some frontline things that we've got to get done too. So is that where you're kind of going with this?
yeah, I'd like to see us contact the IT company. If they don't have the capabilities, let's ask them to go ahead and provide us some potential contacts, so see if we can
Okay,
go out
I
and
know we
get-
have so many IT companies. Which IT company are we talking about here?
We only have one, it's Tech Clarity.
Okay, Tech Clarity, all right.
My organization just rolled out SharePoint last year, and we used a company called Pulse Technology. So I don't know,
Yeah.
I mean, if they
Yeah.
can't, then I don't know. if
There are a
that-
lot of companies out there that have,
Right,
certified professionals in Microsoft platforms that,
yeah.
Okay, that's a good, obviously, we need to, anything to do with the local government as far as vendors, we need to make sure it's an equal opportunity, and maintain those laws and we should do that as just as a good business practice anyway. So, but I think you got the feedback there. You about to say something, Mr. Connor? I'm good. Okay. All right, go ahead and continue.
oh, and then, Member Auger had sent, some information about analytics and.
This
I
is
had
the,
it
this is
pulled
the
up.
Google Analytics that you.
Yeah, I mean, we can cover that under board discussion
Board
if you
member-
want.
okay.
Let's
Yeah,
do it in
that's
board-
fine.
Let's do it in a board
Okay.
discussion. All right, thank you.
Um,
Another question? though?
Yeah,
Okay.
one other thing. So what's the update on the second round of grant applications?
Well, we've received 3 so far.
Okay,
And the deadline
Tomorrow.
was tomorrow. Okay, is tomorrow.
Yeah.
and how many organizations were contacted, and how was the NOFO published?
It was sent out to, I forget the number, 40-something organizations. I made follow-up calls with some to alert them of it. It's on our website, so.
Did this come up at the stakeholders meeting on the 23rd?
The,
It did come up,
Yeah.
okay.
Yeah.
Good, all right. So any additional interest from that? Did that spur? okay.
The only one that I'm aware of that is responding or had interest was Ecker. I mean, they
Okay.
peppered us pretty good when we were there to find out what more they needed to know about applying.
Okay. Okay, so tomorrow's the deadline, and then we'll
Yeah.
see what that, and that's
And
the
I'll be
one that
sending that
where
out
we
to
set
everyone.
aside 200,000, okay.
Yeah,
Sure.
and, oops.
Mr. Kemp?
We've got a second round of grants going out, and we've only received requests for 3 out of 40 people contacted.
Yeah.
Is that what I'm hearing?
But it was also a smaller scope, teen, homelessness, and what was the other?
Teen mental health, homelessness, and adults with disabilities.
Yeah.
Right, so it wasn't like a general.
Homelessness doesn't fall in the purview of this act.
There are, because a lot of the homeless have mental health conditions, so there are many 708 board-funded programs that help people in that situation, kind of like a case management type of work where they
There's a
reach out to
mental health
them.
medical code for
Okay,
that?
no, hold on. We've done this with ABC because they are primarily domestic violence, and we made it clear in the work plan and that it must be underlying causes, mental health, substance abuse, IDD, and our approach is we're going to do the same with homelessness.
My point is telling. We're trying to give away this money and there's no takers. I think we've got too much levy, too much money laying around, and you're giving these guys a second bite of the apple, and there's no takers. I think the need for this mental health board's been exaggerated.
I agree.
Yeah.
Okay, well, we evaluate, we approved that we're gonna do this, we send it out, and then obviously we have a 2026 grant program to implement. And before we make our recommendation to the township board for what our levy amount should be, we will have those metrics too. And that's gonna be a broad umbrella, anything that applies under the act that we can support. So I still think that we don't have enough data yet. Yeah, I'm disappointed here on 3, and we'll see what comes in tomorrow. A lot of people wait till the last minute to file things, so
Sounds like
let's just wait. Let's see what the metrics say, but your point is taken. All right, let's go on.
Great.
Oh, is there anything else from the coordinator's report?
I guess going back just to the second round of grants.
Okay.
I'd like to see a status next month that also lays out the remaining timeline, so we're very clear, so everyone's very clear on what needs to be happened, because as we talked about when we approved this, we're gonna need to review these applications by the next meeting. So Coordinator Sanchez is going to need to get these applications out to us within the next 2 days, 2 to 3 days, per the timeline we discussed at the last meeting.
Okay. All right, we'll make sure that will get done in a reasonable time period, and certainly when our new board member joins us, they will receive that information immediately once they're
It closes
approved.
Friday, so you'll have everything on Saturday.
Okay,
Okay, fair enough.
and same thing for the new board member, they'll have it once it's official. Okay, any other questions or comments?
I have nothing.
Any other questions or comments on the coordinator's report? One question for those who toured Ecker. By chance, did you guys see their in-house pharmacy and their adherence program? Did they walk you through that?
They walked us by.
Yeah, we didn't go into it.
I don't think they allowed us in, and I'm actually glad they don't allow people to just kind of walk in.
It's good about that, but I just didn't know if this was like more just a visual tour, if you had a chance to do Q&A and things like that. Because Ecker, obviously, with an in-house pharmacy, they're unique because they have their own adherence program. I was curious to hear how successful this adherence program is, because that's definitely a challenge for patients.
Yeah. I would say more time during the tour was spent on the critical response team
Okay.
and those programs, which were very interesting, but also very troubling to hear that there are effectively 3 different organizations that are kind of involved potentially at one level or another in providing that critical response to people. And it seems like at a state level, that would be something that would merit streamlining.
That's good to know. Member Corns, you meant additional comments? Okay. All right, good questions. I have no other questions, so for that, we're going to move over to the financial report. Chair will entertain a motion to approve the list of bills of the May financial report. Moved by Corns, second by Connell. Discussion, Mr. Sanchez.
Yeah, you have a revised copy in front of you. I apologize, the total monthly expense wasn't correct when it went out.
Go ahead.
Oh, yeah, sorry, Ray, I'm used to not printing things out for you.
Okay.
They're giving these,
Well, Belinda might show up.
Yeah, that's right.
Okay. Okay, so
Okay, so
anything else?
what changed then? It was a second
The
bill?
total monthly expenses, I just had an incorrect number there.
So 43,404.90 is what we're
Is the
approving.
correct? All right.
Yeah.
All right. And, okay, we
And
got
then-
Q1 invoices and, go on.
And then at the top, I added, under the total, I added the allocated funds remaining, because I had the unallocated funds there before, but just so you have both numbers to reference.
Okay. Now, and then, of course, we're now into May, so at some point, we'll start receiving the 2024 levy monies
June, yeah.
in June, or we might see it on
Well,
the
we
June
might see a
report.
little bit at the end of
'Cause I remember 2 years ago, we started receiving them in May.
Yeah.
You had a question there?
Just looking through my notes to see if there's anything further. No, I guess I was glad to see that you streamlined the Mathers submission. There seemed like a lot of extraneous information that they had sent us in billing.
Yeah, I had a feeling somebody would say something like, hey, we don't need all this, but I was gonna bring that up to you if that's the level of detail that you would seek for a $12,000 grant, then, I can tell them to keep sending that, but otherwise, I will keep it
Good.
more minimal.
All right, a question about Family Service Association. Are we seeing a trend that they're starting to pick up? I was looking at their numbers, and it seems like month of March, we saw either a spike. It looks like we're seeing potentially a trend change. Is that what you're seeing in the data, the 22,289, and we had paid how much to them?
Yeah, well, I think they have natural dips, like summertime, and I think after the holidays, around the holidays time, they see fewer patients, fewer clients.
Okay, so basically, is this a case of spring has sprung, and that's their usual cycle of
I believe so.
they receive?
yeah.
Okay. All right, I just noticed, and certainly we're tracking, just tracking that there. Good job, Ray. Again, initiative, I approve. All right, any other questions or discussions on the financials? If not, please call the roll.
Adami, Auger,
Approve.
Connell,
Yes.
Correns,
Approved.
Kemp,
No.
Avalar.
Yes,
It is approved.
thank you. Moving on to old business, Chair will entertain a motion to accept the resignation of member Aaron Thrower effective April 11th, 2025.
I'll move.
Moved by Auger, second.
Second.
Second by Connell. Discussion and why we're talking about this after the fact, Mr. Sanchez.
I'll let you lead, you had requested to put that on.
Okay, well,
Just as a
we
formality.
hadn't had, it is a formality, but it's just because it ended before the expiration of the term. We couldn't do it last month because of Open Meetings Act, because we didn't know it was coming. And therefore, that's why we're accepting it now and formally accepting. I mean, some might say, well, it's perfunctory, but I'd say let's get it on the record that we have accepted the letter of resignation, and we gave our farewells last month when Member Thrower was here, and that's basically what this is. Basically, it's more of a perfunctory, we accept it as a board. If no other questions,
Here,
Mr. Kemp?
was there a letter?
Yes.
Are we privy to that letter?
Yes. And she
Yeah.
submitted it.
Yes, she submitted it.
Yeah.
Is it somewhere where?
So why is the letter not in the packet is a better question. I think that's where you're going.
Yeah.
Where's the letter?
Oh,
Can I
you know what,
read it?
actually, I don't think she gave me a copy of it. I'll have to ask her for that. Now that
Well, we all saw it.
she had, yeah, she had the sheet, but I don't think she actually sent it to me. No.
Okay, so when she tendered it, and it said effective April 11th, it's in writing, so is the case where she was supposed to send something, or she just not?
Who took it?
I think it's probably on her desk right now in her office.
Okay,
So I'll get a copy of that and send it out to everyone, but it was effective, that was her last day as a board member. That was her
Correct.
intention. So the following day on the 11th.
Well, I watched the video and I didn't see a letter get presented to anybody. I don't know. I just.
you were
I
sitting
was
next
sitting
to her.
next to her, yeah.
You
she-
saw the
she
letter.
said, This is my letter of resignation.
I was sitting on the
And
other
then
side
she
and
gave
I
a
saw it.
speech and.
So she did
She did.
a letter, okay.
Okay, so with that, please call the roll.
Auger,
I approve.
Connell,
I approve.
Corns,
Approved.
Kempf,
No.
Avalar.
Approve.
All right, it is approved.
All right. Chair will entertain a motion to approve amendment to the bylaws regarding vacancies on the Mental Health Board.
I'll I'll move.
Moved by Corns, a second.
Second.
Second by Connell. Discussion, I will lead this discussion. This is something we talked about both when this change to the Community Mental Health Act was being contemplated back in 2024 during the spring session. And it's this section here, I'll read it out loud. A community mental health board may provide advice to the governing body and may establish a policy and procedure for the acceptance and review of applications from interested residents prior to making a recommendation to the appointing authority. I explained at the time, and I definitely reassured Supervisor Thrower, this provision of law was not because of the Dundee Township Mental Health Board. This is something that Representative Ness, one of our state representatives, wanted to add. Those of you who know about Representative Ness, before going to Springfield, she was a member of the McHenry County Board for a little over 2 years, and there was definitely a lack of transparency of mental health board applicants to their board. And this was and obviously it's from a direct experience of someone, and any of you who knew the then McHenry County Board chairman at the time, this is not a surprise. He didn't share, and even members of his own party brought this up. Another area that promulgated this amendment was due to a downstate county mental health board, where when a mental health board appointment makes headlines, it's getting out of boundary there. And apparently some people on the Madison County County Board did not see all the information. The member was approved through advice and consent, but it did play a lot of press. So there was thought to be a need, and that's why the legislature approved this. So therefore, our rules are our governing rules are the bylaws, and those are our rules. And so after discussing this, how we did this back in the February and the March meeting, I went ahead and had this drafted, and it did go to council for legal review. And basically it reads, the board shall consist of 7 members appointed by the Dundee Township Supervisor with the advice and consent of the Township trustees. Members of the board shall be residents of Dundee Township and shall include qualified residents as defined in the Act. Now, our bylaws had what those qualifications were, but that was another change that was made to the statute. And remembering the discussions back in 2023, we didn't want our bylaws to be a data dump of the Community Mental Health Act. So those list of qualifications were removed. But the changes here, here's the change. All residents shall express their interest for appointment to the Mental Health Board in writing to the Dundee Township Supervisor after written notice is given to the Dundee Township community. The Township Supervisor shall provide to the Board all unredacted applications and letters of interest from residents expressing interest to be appointed to the Board. The Board shall review and discuss applications and letters of interest, conduct interviews if appropriate, and make recommendations to the Township Supervisor not to exceed the number of board positions to be appointed. All interviews shall be conducted in person. The Township Supervisor shall present the nominations with the Board's recommendation to the Board of Trustees of Dundee Township for advice and consent. As only one board member shall be a member of the Board of Trustees of Dundee Township, reviews, discussions, and interviews of Board of Trustees of Dundee Township members shall occur if more than one Board of Trustees of Dundee Township member expresses interest to be appointed to this board. Should the Township Supervisor also conduct interviews with residents expressing interest to be appointed to the Board President and the Administrative Coordinator shall be present in person for the Township Supervisor's interview as observers. Board members seeking reappointment shall recuse themselves from all review, discussion, interviews, and recommendations. It's fairly straightforward, but this is establishing our rules based on the statute that we're allowed to do for advice purposes only. We don't have the final say. That's up to the elected township board members. So this is the offering, and if any other questions or any further discussion. Mr. Auger.
I'll bring up my request that I had sent to you directly in email, but I would like to see us cite the Community Mental Health Act section that this applies to, so that these board members as well as future board members know where we're referring. The Community Mental Health Act is a fairly lengthy document, and I think it would help to be able to identify specifically what it applies to or what it's derived from, because really, we're supposed to abide by the Community Mental Health Act. So these are clarifications to how we're going to interpret that act
Okay.
or apply it.
Are you offering that as an amendment to the amendment, or are you offering that as something to do in future for future?
I am offering it as an amendment to this approval.
Okay, so your motion for an amendment is to
I
add,
move to add the Community Mental Health Act section that this bylaw change derives from. And going forward, any future bylaw changes apply the same principle.
okay, for this amendment, let's just keep the first part what you said, which I
Yep.
want to say, add the Community Mental Health Act section to the bylaws change where the bylaws change derives from.
Yeah, just a little parentheses.
footnote.
Yeah. I think we could probably just put a parentheses right here at the end of this section, qualified residents as defined in the act, and then cite the section there. That
Yeah.
probably would be an appropriate.
Yeah.
place
Okay.
for it.
We'll double check, that might be two different sections, but any section, now, we're not going to get to the point of, well, second sentence or fifth sentence or fourth.
Yeah,
We don't
no,
have to get
no,
to
no.
that point, right? Okay,
Get-
I'm
get
glad we're in
the-
agreement
get
there.
the general high-level section.
Okay, so the motion is to approve the amendment presented by Member Augur of add the Community Mental Health Act section where the bylaws change derives from. If there's no other discussions or questions, the vote on the amendment to the amendment.
Was there a second to the amendment?
Was there a second to,
Sure.
is there, okay, Member Corns. Now we have a second. All right.
Discussion?
Oh, thought we were done. Go ahead.
This is not what you sent me the other day. And this is my point with my email to you to clarify, to clean that up, because I've got different verbiage which made no sense to me. I've got, as only one board member shall be a member of the Board of Trustees of Dundee Township, are, comma, discussions, comma, of trustees of Dundee Township, of trustees of Dundee Township. So now, I don't know what happened, but this makes a little bit more sense. So I just want to clarify why I was going back and forth with you, President, because I spotted this, I didn't even know what the heck it was. It made no sense to me.
Yeah, I would guess that there might just be a formatting issue, like, because did you only access it on your phone, or did you access it on a laptop or other computer?
What's a laptop?
This, look at Ray's computer. That's the laptop.
It
So
has duct tape.
This is a notebook. This is a laptop.
Yeah, sometimes
these
phones are-
bylaws are a constitution. You don't change bylaws lightly. It takes a 2/3 of the majority to vote for that reason. So the Public Act is what drives the bus here. Our bylaws set fiscal year, things like that, that's unique to this organization.
Okay.
So what is the purpose of changing the bylaws? The Public Act is what dictates what we do. What are you doing with this change? You're setting policy that you're going to interview these people, or you have the ability to interview, you have the privilege of seeing the documents where before we didn't? I don't understand
Okay.
what our motives are here. to
Okay, the
change
motive
bylaws.
is we are implementing a change in the Community Mental Health Act that allows community mental health boards to do this, to increase the transparency of all interested residents who want to be on the mental
I've
health
got
board.
that from the Public Act. Why do we have to change our bylaws because of it?
Because the public acts, because,
Because
It's
our
right here.
previous bylaws wouldn't have.
correct, our previous bylaws don't have a provision for this. And to set up a rule, and that's what it says here, may provide advice to the governing body and may establish a policy and procedure for the acceptance. We're
So that's what
establishing.
we're doing.
Yes.
We're establishing this policy and a procedure for the interview process of the new board members.
Correct.
Okay.
Under the new section, under advice. That's why it's
Because I
advice.
don't like changing bylaws just for something to do.
Fair enough.
Alright.
And you also notice it was your feedback, I remember from 23, that also we clean up so we don't become a data dump either. And we cleaned up that language too. Okay. Any other discussion or question? All right, roll call on the amendment to the amendment.
Okay, on the amendment to the amendment.
Whoa, what?
Okay, Member Augur's motion.
Amended it to
Add the section, which in this case is,
the reference.
right,
I understand
405
that.
ILCS
What's the
20/3.
amendment to amendment?
Well, this is an amendment to the bylaws
Oh.
technically, so, that's
The
that's the
amendment
main
To
motion.
the amendment
The
to change the
initial motion.
bylaws. I
We're gonna
thought
do
there
two
was
votes.
Two amendments
Right.
going here.
Yeah.
That's why I
I got
said
it.
amendment to amendment. Okay.
I'm good.
Okay, first vote, first roll call.
Okay, Augur,
Approve.
Connell,
Approve.
Corrents,
Approved.
Kemp,
Yes.
Evler.
Yes.
Okay, amendment is approved.
So now we're going to
That's
have
the main motion.
the main motion of the actual amendment itself. Roll call, please.
Augur,
Approve.
Connell,
Approve.
Corents,
Approved.
Kemp,
Yes.
Evler.
Yes,
It is approved.
and it is with a supermajority, so amendments to the bylaws approved, we'll get those published, and we'll add the reference, which is section 3A. All right. Okay, now we're going to discuss the survey per Member Augur. So, Mr. Augur?
Okay, since there is no material in the packet, I had sent it out via email to everybody. I don't know, is there a way that I can quickly, oh, you have that up there, great, perfect. All right, so at the last meeting, I provided a summary of organizations that I contacted to provide a survey for us. NIU is no longer in business, so Member Kemp, that option is off the table. Dr. Schneiderman will be going ahead and starting up a independent consulting business. The cost of that survey would be $8,000, sample size of 3,000 people, target response of about 750 people, basically the same approach that was used in the needs assessment for contacting people. Another organization contacted was Metopio. Metopio works with Kane County. I believe they did the health needs assessment survey for them. They quoted us $7,500, doing 2,000 sample size. They would expect 500 back. TriWest quoted us at $150,000 to $200,000. I think that's probably outside the scope of what we can afford. Another organization, national organization that was contacted was Interaction Metrics. They quoted us about $6,000, I think it is, but the resident list cost they could not establish for us. So that seems open-ended. They still have not gotten back to me. Beyond Feedback was another national organization. They quoted us $26,790. And ECC at the time had not responded. They did not do surveys directly, although I think as we look into future work, we might want to look to some of their social science programs as an opportunity for us to try and partner with them to do things for us, whether it be things like SharePoint or some other type of things, surveys, but that might be a good way to engage the community in the things that we're doing, and perhaps use it as an opportunity to grow people that are interested in the mental health type field.
Excellent.
But this is the summary.
Is there anyone below ECC?
I don't believe
Making
so.
No.
sure. What?
Well, I'll do it in-house.
Yeah, if we did it in-house, but again, we hit the same constraints of we have one person split many different ways, and I think at the end of the day, we'd probably have a more credible result if we allowed somebody that does this directly to handle it. There would always be the factors of, well, okay, how did we select the people? Somebody independent does it, that whole thing goes away.
Okay. Good. All right. Immediate feedback from the board.
Too early.
Okay. Member Corns?
I guess, yeah, I mean, I could see doing it later, I said that before, but if we want to move forward and doing it now, I would say one of the top two.
Okay. Member Connell?
No, I have nothing.
All right. From Member Augur?
Yeah, I guess, just to respond, to both Member Kemp and Corins, you got to keep in mind that we want to use this data to help guide us in our 2026 planning. So, we're not going to approve it now until at least June. That means, you probably got about a 3-month window to actually get the surveys taken care of. That takes us out to, July, October. So, we're putting it off. Any further, we'll likely miss the opportunity for us to use that data to help us direct what our actions are going to be in the coming year.
Okay. My only, obviously, the lower, the high cost ones, those are, as Member Corrin says, is coming down to the top 2 that's still in business. Of those 2, I see Metopio with potential opportunity to expand upon what they've done with the county and possibly get access to the data that they've collected in order to enhance. Now, the actual engagement is going to be for the survey, and we're not going to go beyond that. But certainly, if there's any synergies that we could use potentially for future to where we don't have to do full-blown needs assessments, but get access to data to help us assess, as I would say, the pulse of mental health and substance abuse in the township, we have those potential synergies. So even cost-wise, they're the lower cost.
Yeah.
If my glasses are right.
Yep.
Anyway, so that's basically, it's a bonus. So of all these, I'm definitely leaning towards Metopio. But if we learn any additional information between now and next month, I'm amenable, but it's going to take a good case to why we wouldn't go with Metopio. Any additional, Mr. Kemp?
You're looking at 7,500 for 2,000 pieces.
Mm-hmm.
What's 3,000 pieces cost us? 9,500? I mean, you don't have comparables up there.
Did they give any kind of structured pricing or graduated pricing? Mr. Auger?
So I made the request of, what would the cost be for a sample size of 2,000 and target response of at least 500, and that's what they gave me. Mindy Schneiderman gave a slightly higher cost with a slightly higher number of sample size that I believe had to do with the demographics, making sure she seemed to think that we would need more to I guess, achieve the right demographic mix that she had done earlier. It's spelled out in the, if you read the quote from Mindy Schneiderman, it's explained there.
Did we do a 3,000 count on the needs assessment?
No, it was a 2,000. It was
So
2,000.
she went up.
Yeah. Actually, to be honest, the number, the quote for 2,000, I believe, was something like $10,000. And it had to do with the demographics, making sure that the demographics were more distributed rather than just picking a random number of people.
Since Schneiderman went into business for herself, do you have any client feedback or references, or is it too soon for that?
Too soon.
Okay. Because that just had to happen just at the end of last year, where she's now
Yes, I mean, it
freelancing.
is
She's basically
just, well,
freelancing.
at the end of this school year, I believe, is when they're closing down the Center for Government Studies.
Okay, so it's on its last month of life,
Yep.
in other words. Okay. All right. Any more questions or discussions? Do you have what you need from us?
Yeah, I think the only action or request that I had was to go back and get a more formal quote from Metopio, and I will take care of that first thing tomorrow.
Excellent. All right, moving on to item D, policies. And do you want to lead this, or does it member?
I didn't receive any feedback from board members, so I didn't know if anybody has any that they would want to give forward at this time.
I had a few that I looked at that I found interesting, that we might want to consider as our board. And I don't know if we have any of these already, but one was the conflict of interest policy. And I was thinking there was, I think one as well around ethics, and even like if there's a way to combine those two, to have a policy around ethic and conflict of interest. And then there was one on our social media policy that I thought was really helpful. strategic planning, and then funding guidelines were like the four that I really highlighted as a point of interest. So I can send those to you too, but those were the ones I looked at more in depth and felt applicable to our board as well.
Good.
Yeah.
Any other ones?
I will give my results, my comments by Monday, although I think one we've got to add to it based on the bylaws change is going to be a policy for interviewing candidates.
Got it. Okay, any other feedback? I think, you mentioned social media, and I just want to make sure that if, Jared we put in a very good comms policy that did cover social media. So if there's something more that they're doing beyond what we're doing, maybe that's what we look at there, but I just know that one jumped
Yeah,
out.
I think if I remember correctly, it was St. Charles and a lot of other boards that do have a social media policy, because not all do. It typically refers to board members' conduct online.
Oh,
There
okay.
was a section on there.
That's what, okay,
Basically,
that's what's different. Okay, now I know what's different. Okay, good.
Yeah, so that is something you could consider that's different than what we've discussed before.
Okay.
Sure.
Good, well, we'll collect this, and we'll see when we'll put this on for further discussion. Next month is gonna be dedicated to reviewing applications, so probably July is probably the earliest time period because of the amount that's gonna be taken up next month. Okay.
Okay, Mark?
Oh, Mr. Kemp,
I didn't hear what you said.
okay.
That our board has a social media type,
We have a communications that included social media, but we're a member
communication, what's that
quorums.
mean?
I'm sorry?
A communication, what does that mean?
Policy.
Communication policy. We approved it sometime last year, I don't remember when. And where Member Corns is coming from is, the policy she saw included board members' conduct online. That's something we don't cover with ours. So we'll look at the gap and see what that's appropriate. It's good. All right, moving on from policies, we're gonna move over because there was confusion in email as far as the proclamation, and the proclamation was not ready, so we're gonna move over 10A. Very briefly, the General Assembly, between now and tomorrow, they have to approve a bill known as Senate Bill 709, Senate Amendment 1, was this Prescription Drugs Affordability Act in the 104th General Assembly. So items A and B was to authorize us formally to lobby as mental health board members. There's nothing that stops you from submitting a witness slip as individuals, but given there's also some confusion that went about in the in emails, which that's too much too soon. So we're just going to move over that, and we'll see what happens in Springfield by tomorrow. The specific area that this covers are pharmacy benefits managers, not Big Pharma itself. And the key parts of the legislation that I reviewed was auditing, annual audits, and the accountability of costs. How much are PBMs injecting into the cost of meds, which of course our patients in Dundee Township need access to, and the PBMs are your legal drug middlemen. That's what they are. They've been a pain point. Just for reference, in late 2019, I participated in a pharmacy prescription drug cost roundtable with our then Congressman Sean Casten, and he was focusing solely on Big Pharma. And myself and a couple other folks said, time out, you gotta look at the full picture. And PBMs have been notoriously left out, and they also have very effective lobbyists. And a set of lobbyists that you wouldn't, at first glance, you wouldn't know, well, why are they working together? It's basically the PBMs themselves and public sector labor unions. So with that, a vocal set of lobbyists have been very clear, try to keep it all on Big Pharma. Everybody from people on the far right to across the spectrum saying something has got to be done, we got to open their books, and we have to make them accountable here in the state of Illinois. And this is all to ensure that our residents receive the best possible prescription meds for the lowest possible costs. So that's what this was about. Keep an eye on this, because this is something that's long overdue. Like I said, in fact, in my private sector work, I helped one or two congressional candidates document this, and that was back in 2019, 2020. And here we are 5.5 years later, and finally something's getting done. So things do get done eventually, even though we would like to see it done sooner. Mr. Auger?
Yeah, I'd request going forward, if we have any motions like this ever again, you've got to, the packet has to include more information than this. As I sent out to the blind CC, to the board, some investigation that I did because it was not clear to me, what was being asked here. There's a lot of information. Quite frankly, Senate Bill 709 is chock full of various amendments. So if you look at it, it's covering a multitude of things. It was a gutted bill. And we've got to, as a board, if we're going to be asked to sign up for proclamation, to support a proclamation, we've got to have the data, and this data was insufficient.
I agree, and that's why, and even before you said that, that's why I agree. Let's not try to do this tonight. At the roundtable, did the legislators' representatives address the Senate bill? I remember I asked you guys. No?
And
Okay.
quite frankly, this is not in any of the ACMI legislative briefings that get sent out to us.
And the reason for that, because I did bring this up, definitely at the last two general meetings of ACMI, is what are we doing about PBMs? This amendment wasn't even filed until April the 4th. Just so you know, it got an extension to tomorrow, May 9th, for approval out of the Senate under the legislative rules. Whether it will get passed or not, we don't know. If it does, great, then they'll be concurred in the House. If it doesn't, then we'll know that certain potential lobbyists got through the senators and it stopped, and they'll have to be taken up next year. This is a very controversial issue because the big three, CVS Caremark, Express Scripts, Optum Rx, that's where 80%, and a letter that Member Auger attached in his email today also included what attorneys generals are asking at the federal level, and it was 38, 39 attorneys general across the political spectrum. So it's definitely a bipartisan letter saying we need to stop independent pharmacies from being squeezed out of the markets by affiliated pharmacies with PBMs. It's a tip of the iceberg, and definitely I'll do better to prepare for this in the future, but certainly it is something that we need to keep an eye on, because just like a year ago, Healthcare Protection Act was passed, step therapy was eliminated. That takes effect July 1st. Member Kemp, you had a question.
What is the purpose of authorizing us to act as mental health board members? Is that supposedly got more clout with the legislator because we're on a board that spent tax dollars? I mean, we're all free to file witness slips and anything and approve or oppose certain bills. I mean, that's part of the process. But why does it make it to my agenda tonight? What was the purpose of this?
Purpose was that in the past, when we've asked for witness slips, we've always said to make sure you're doing this as an individual, not as a member of the mental health board. I honestly felt, and obviously we weren't ready tonight, that if it impacts our patients, we need to take an active role. Definitely let our local legislators know. That's why I'm surprised this didn't come up with the state senator staffs last 2 weeks ago. We need to take more action to help our patients. And if it goes beyond just doing something under our own names as a self or as a member of the mental health board. Now, electeds can do that at any time because they're elected officials. They're accountable for whatever they do. But since we're an appointed board, I felt we should authorize us to do that if in order to support this. That's all. We're trying to do things for our patients. I think this is something that is definitely important for our patients, the affordability of the prescription drugs.
So if I'm correct, this is like my property owners association.
Okay.
You got a voice that represents the neighborhood. We represent a board.
Mm-hmm.
So that's what you're talking about, authorizing us as a mental health board member. Just like when I got a problem at the county, the POA is a very good organization, strong, so that's just a clout issue, is what I'm seeing. Right?
Potentially, yeah.
Okay. That is all.
Good. Any more questions? All right, with that, the chair will entertain a motion to enter into closed session for the appointment, employment, compensation, discipline, performance, or dismissal of specific employees.
Wait, were you gonna?
I'm sorry. Thank you. You got a motion to go into closed session to discuss the discipline, performance, or removal of the occupant of a public office. Thank you. Is there a motion?
Motion.
Motion by Corins. Second? Second by Connell. Roll call, please.
Auger.
Yes?
Connell.
Yes.
Corns.
Yes.
Kemp.
Clarification. Why are we going to executive?
Motion. Discuss the discipline, performance, or removal of the occupant of a public office.
Occupant of a public office.
Correct.
Okay, do we not need a motion to change this? Because that's not what the executive session,
For a closed session, it doesn't require there to be the specific language. So you can call for closed session for any of the exception reasons. Because in closed session, you're not actually deciding anything. You don't make decisions in closed session, you have
Okay.
discussions.
Correct. Okay. So with that, roll call, please.
Well, he's on me.
It was on Kemp.
No,
And Avalar.
Yes.
Okay.
All right.
Was approved?
Thank you. This should be a very short executive session, so we should be done within 15 minutes if you've been that. You got your...
Okay.
And when you're ready, then...
That's 8:27.
All right, regular meeting of the May 8th of the Dundee Township Mental Health Board is called back to order, post-executive session. There is nothing to report out of the executive session, but the chair will entertain a motion to authorize the executive session secretary to remove recording device off premises for the purpose of preparing executive session minutes.
Approved.
By Corins.
Second.
Second by Connell.
Why not?
Discussion. Roll call, please.
Auger.
yes?
Connell.
Yes.
Corns.
Yes.
Kemp.
yes.
Avalar.
Yes. And that is it. Now go to board member discussion. We'll start with Mr. Auger for analytics.
Okay, actually, a few things I want to go over. Before I get to the analytics part, wanted to make people aware, Proviso Township has a mental health board. And they actually ran some commercials over the radio that I heard on Sunday while coming out of church. Might be something we want to think about in terms of outreach. I don't know what the cost is. You know, we'd have to do some investigation, talk with them. You know, they may have a budget that far exceeds ours, but I thought it was very interesting that they did that. So then I'll move on to the analytics part. So one of the things that, one of our goals, goal number one is outreach. And the idea is we want to try and make people aware of resources that are available to us. Well, what I thought we were lacking is any way of measuring how many people actually come to our website to take a look at it, and when they do take a look at things, what do they take a look at? So with Supervisor Thrower's approval and this board's knowledge, we went ahead and we selected Google Analytics. It's a free service. We had Revise put some Google Analytics code into our web pages. I'm sorry, Revise put it in there. And we have been successfully capturing analytics for the last month. I sent out a packet to the board showing the type of things that we have access to.
Ray, did you want me to pull that up on here?
Yeah, if you want to, we can take a look at the presentation just real quick. But it is something that I think we should take a look at. I think at the time we've had about 150 people that have looked at our website. We did have a bit of a hiccup. I'll call it an anomaly, and yeah, just those right there, where some entity from Aspen had about 6,500 attempts on our network, which did not look right. It went away, but it is something that I have filtered out of the data so that we can, kind of focus on what is really happening. So In terms of overall users, like I said, we've got about 100, as of this presentation, we have about 115 total users, 115 of them are active. 87 during that period of time, which is 28 days, were existing users, and then another 25 that were returning users. By comparison, I've got the township total numbers on this side, and what we're looking at is entities that land on the website. Let me go down to the next page. These are some of the graphs. Acquisitions, we can understand a little bit about where the users are coming from. So some of them are just direct content. Others are, by that I mean they're typing in searches of their own. There's definitions for all of these to back them up, but it kind of helps characterize how the users are getting to our site. What you don't see on ours that is existing on the township are referrals. So these are pages that somebody else has the Dundee Township page on there, and they're clicking on it and getting to ours. What I would like to see are referrals on our side, because that means our service providers, whom we have contracts with, stating that they are supposed to be publishing us on their websites, would take them there. And specifically, Mathers indicated in their report that they've created a website for us, or a web page for us. I went to the Mathers site, didn't see it there yet. So I guess I'd ask Administrative Coordinator if you could follow up with them and find out where that is. That would be very interesting. But so that's another facet that we can look at. Again, charts. We can look at the specific pages that people are looking at to kind of get an idea of where their interests are. Another thing is what they call events. These are the specific actions that people are taking, whether it be page views, the first time they're starting a session, starting a visit. But one of the ones that I was interested in was downloads. So we've had 34 downloads. While I don't have a report here for this, what it tells us is the type of things that people are downloading from our site. Specifically, the 34 had a number of downloads for our second round of grant applications. So we could learn some things about that. Then I think that might be it. Demographic data. So again, we can learn a little bit about where the users are coming from. Some of this may be a bit misleading. San Jose, depending on where your service provider homes your IP network, you might show up. I sometimes show up as Oklahoma.
Who is Silicon Valley here? Wait a minute. One of you guys been traveling and didn't tell us about this? What is this? Okay. Go on.
But it kind of gives us an idea of where our users are coming from. And similarly, I don't think I have it here, but we can also get it by country. This may be a little bit too nerdy for what we're looking at, but it's something that if we want to try and improve our website to try and make it more useful to our residents, this may help give us some insight into that. If we're not getting access on pages like the resources, maybe we need to present them differently. And it is set up right now where if different township departments would want to use this, the analytics code is there. The departments would just have to determine what reports they want. For example, I did reach out to Mike Belak, the assessor. He indicated that I guess they have a connection to our website. They don't actually use the pages, so it may not be as applicable to him, but open space, cemetery, highway, things that could be used there. So thank you for humoring me presenting this. Hopefully it's something that we can use going forward.
Okay. Is this all you have for your update?
That's it.
Any questions for Mr. Auger? Mr. Kemp?
Can we go back to that one that had San Jose on that?
Yeah.
So this is our mental health website. And we're getting 6 hits from Dundee, 6 from Geneva, 5 from Carpentersville.
Yep.
It doesn't seem like there's a lot of use here.
Yeah, I mean, we've got 115 users over a 28-day period.
I'd like to know the people in
And
Salem.
we don't know if that's repeat customers or they
Those are
different.
unique.
They're all
Th-
different.
Those are unique customers.
So we're trying to grow this website, and it appears like there's not much interest in it.
Well, that would be kind of one of the reasons for trying to grow it. We have we're supposed to be getting information out to the public to help them, facilitate getting mental health, substance abuse services, and quite frankly, our website probably isn't cutting it. It's there, but
It
it's,
could be indicative that there really isn't a great big need for a mental health board in this township.
and that's,
Like the boogeyman that probably was conveyed to us in the 2020 referendum.
yeah, I mean, I don't know that this alone
Yeah.
would lead us to that conclusion, but, it does tell us objectively, we've had 115 unique users over a 28-day period.
Got it.
Yeah, I don't think it speaks to a lack of need. I think it could be a number of things of like not as user friendly. It could be that, again, that people in need actually don't know where to look half the time. They don't know that the services are available and.
Yeah. I mean, one example, we put together, or we received from our needs assessment survey, a list of about 80 organizations that provide mental health services within about a 10 or 15 mile radius. That information is a PDF file. So someone that's wanting to figure out, where can I go for teen mental health services, they have to scroll through. Whereas you look at the McHenry County website, and they have some capabilities to filter that information and pull up that list.
And you can search by
So-
category and.
Yeah, exactly. So something like this could help support the need for spending money to go ahead and make that kind of a change on our website in the hopes of getting more users to being able to answer users' questions.
Mr. President, if I could add.
Go ahead.
Just in general, government and government-related websites are not going to have high traffic. So that's just something you have to understand. It's really a matter of quality over quantity. This isn't, a business where we're trying to get thousands and thousands of people. Realistically, we're not going to get those huge numbers to no matter what we do unless we start, giving away money or cars or something, right? So, but also at the same time, yes, doing what you can to start to see those numbers go up, over time, in whatever way that turns. And I think getting back to like the marketing idea of like, radio ads and social media buys and things like that, that's all going to help filter in, and you'll start to see more and more. And looking at the township numbers, they have a lot going on. They have assistance programs that
Yeah.
are probably driving the most traffic to the site, right? So for us, it's still new and not providing direct services, right? We're just kind of like a signpost and an information depot kind of thing. So yeah, it's never going to be huge, right? But it's, again, quality over quantity.
Okay. Any other questions from Mr. Auger? One thing, I'll shed a little light on the Aspen. About 2 months ago, I received, either from Coordinator Sanchez or Supervisor Thrower, I received a suspicious email claiming that some friends of mine from college in Colorado found me through our website, and it read like a scam. There was no way I was going to return the call or let alone the email. So I just basically trashed it because it was suspicious. It was forwarded to me from info@dundeetownship.org. And, so many scams nowadays, and with artificial intelligence, being able to say, oh, you went to school here and you know this guy here. They tried to personalize it, but it just wasn't real. So, and some of y'all might see that in your inboxes too, but it definitely came through mine. And I just basically disregarded it. But if this is a pig butchering scam out of Aspen, that could be it, because it definitely used Colorado as the point. So just FYI. Okay, continuing board discussion. Member Kemp. Anything to discuss?
No.
Member Connell.
No.
Member Corrins.
Just since we were talking earlier about just for legislative that's up for election, I, again, part of my I guess my day job, I ended up attending, some information on, it's called HB 1085. And it was really dedicated towards, helping mental health professionals be able to bill in a certain timely manner and be able to see clients for a full 60 minutes and be able to bill for more because they're not getting reimbursed from insurances as much as they should. So I can send out some information about that, but just again, so you guys are aware too, if we are looking at different things legislation that might be applicable to the mental health board, that was one that I came across.
Good. Thank you. All right. Moving to the board president update, two things have happened that I'm going to inform the board about. Even though it was not an official board business, I did testify before the House Labor and Commerce Committee in Springfield last week. I did bring up my experience as the Mental Health Board president in order to discuss the topic that was brought there. Legislation I've been working with State Representative Ness for a little over 2 years. It was a very successful subject matter hearing, but I can send offline my prepared testimony and not take any more time here, but that did happen on April the 30th. As we move forward as a board, no matter who the voters elect, we have our plan, and we're going to enhance our 3-year plan, and we are going to move forward to help residents overcome whatever challenges mental health, substance abuse, or individual development disability. They're not going to be forgotten. They're not going to be left out. But let's all remember why we're here. And we're looking forward to working with our incoming board members township board members in order to ensure that we fulfill what the voters tasked this township and through this mental health board to do. And let's do it. Let's do it well. With that, I'll entertain a motion to adjourn.
Move.
Moved by Corrins.
Second.
I'll give the tiebreaker to Connell. All in favor, please signify by saying aye.
Aye.
All opposed, same sign.
Aye.
Adjourned.
When you see